again, thank you for coming to the class of 2025 of the HSB podcast series. 2025 has been such a year, and at HSB Global, we've tagged 2025 the year of the big shift. So please permit me to walk you through some of our biggest learnings in 2025 of this year. First of all, I would like to introduce myself to you. My name is Ezine Asor, and I'm your favorite host of the HSB Global Health series. This is a conversation that was started in 2023 because we believe that there is not much support for leaders in healthcare. And, just by providing them the opportunity to cross-learn and to cross-share across market is very important. I am a pharmacist by profession, and I hold an MBA degree focused on the business of health, technology, and innovation from the Johns Hopkins University. And I'm always passionate about talking about how to solve and how to improve healthcare systems globally. Professionally, I have worked as a market access professional in different settings, both in the innovation space, public health, and also, working for innovation hubs. And I'm very excited to, share some of my biggest lessons in 2025. So, ladies and gentlemen, with that in mind, 2025 season has come to an end. Can we say yay? Yes, 2025 season has officially come to an end. And 2025 reminded us, specifically in the HSB podcast series that healthcare is no longer just about care. Healthcare is no longer just about care. Healthcare is now more about systems, financing, leadership, and most importantly, execution. And I think that is the big shift healthcare has witnessed this year. Since January, we saw how the impact of the funding. It almost felt like all the countries were in scrambles trying to find out how to respond to that big shift in the funding cut for healthcare across not just Africa, not just Asia, all over the world. The entire healthcare system experienced a global shock to the news about the USAID funding, amongst many other funding schemes that have been financing healthcare. So at HSB, we tag 2025 the year of the big shift, where healthcare leaders and professionals need to begin to see that healthcare is no longer just about providing care, but more about the systems, the financing, the leadership, the execution, the delivery, the markets, the systems, in generally. And I think that is what to pause, and that is what examining. And that's why we are here to support leaders in healthcare by providing them the right information, the right skill set, the right support and support for their technical areas in general. So that is the first big shift we would like to highlight this year, 2025. So why did 2025 matter? This was one big question we have to, be very realistic with, right? I already said it, the pressures of healthcare system globally. I mean, imagine what that news caused a lot of clinics to shut down. A lot of patients did no longer had access to life-saving medicines, and that is a threat to life globally. That is literally a threat to human life globally. And I think it calls for a deep reflection coming, as we're entering into the new year of 2026. What are we going to do differently? How are we going to react? How are we going to innovate for healthcare? How are we going to collaborate with both public and private sector partnership to make sure that healthcare work? Basically, these are things we all need to think about, not just our government, not just some of our leaders, everyone who's working in healthcare. There's been a lot of shift. I recently read a statistics from WHO that says there's going to be a shortage of doctors globally. Globally, there's going to be a shortage of doctors globally, and that estimate was it about 1 point something million. And that's a threat. That's a threat to with the growing population. That's a threat to the future of healthcare. If we are saying we have a shortage, and by 2030 there's going to be a shortage of 1.3 million healthcare workers in was that, am I even talking million? That probably is much more than that. So I will probably need to check it, and I'll put it in the post. But we really need to sit up and think about what we can do in supporting healthcare systems globally. Another thing we saw is I think we've talked about, we cannot overflow the need of new financial instruments and new financial, how we draw up financial systems, how do we innovate for healthcare financing. this is so important that it cannot be underemphasized. It really cannot be underemphasized. The lives of patients hinges on this. I can imagine how, a lot of patients who were supported by USAID's medicine, how are they even surviving? What are they even taking? So we no longer need to sit down and wait for someone to come and save us. We need to think about how do we build sustainability in healthcare financing. This is really, really important. Another thing we see that mattered in 2025 is the rise of AI, data, and private sector involvement in healthcare. AI has changed the landscape. I think it's always changed the landscape, but it became much more pronounced this year. I mean, there's been a lot of pressures on healthcare and innovators in healthcare to adopt the use of AI in their system, not just for efficiency, but even to lower the cost of the cost of operational cost of their business. And I think that for any healthcare leader, this is one thing that you all need to think about. How do we infuse AI? I just recently was watching a video about a clinic in China that was doing surgery with a robot, right? And the accuracy was just top notch, right? According to the research, it said it did better than a human surgeon. I think that this is where the access to care that patients really need would be expanded, just because we have the use of these tools, artificial intelligence, and beyond that. And so at HSB Global, we hosted a AI summit, and look out, because by March we'll be having a new AI summit specifically for healthcare leaders and business professionals who are looking to how to adopt AI in their healthcare business. So yeah, definitely this really matters, and I think everyone should keep a close tab on it in the coming year. I also attended a healthcare summit, where I was able to interact with some of the innovators of emerging tools in AI for healthcare. I learned quite a lot. I saw a lot. I could see some things that we could approach in different markets differently. I think what makes it really unique is how the markets in one country is more matured in adopting digital health. But despite that, I mean, the willingness of patients to hand over their care to there's not it's not been commensurate. It's not been commensurate, adoption from in different climes. And I think that's going to change in 2026. And this is one area that I believe all healthcare leaders need to keep a close tabs on in 2026. Another thing we saw is the growing importance of local leadership, right? And market specific solutions for healthcare. And that was the reason why we added the local leadership series, because, at the end of the day, leadership is local, right? You can have the global practices, you can have the global schemes and all, and how best to work globally, but at the end of the day, it all boils down to the local market, because all markets are very different. All markets are not the same. And I think that as healthcare leaders, we can approach this differently in how we, you know in basically how we innovate for healthcare, right? I think that one of the podcasts I had, one of the speaker was talking about how she has a lot of degrees and all, and I was like, oh, you really can't take Harvard Business School, maybe Johns Hopkins Business School education and take it to somewhere like Maiduguri. It's not gonna work. Like, we literally need to relearn leadership in that context. And I think that is why we added the local leadership, series, to really learn from leaders locally who are doing the work, to see how they've been able to navigate the systems and the market. I think this is one thing that we need to bear in mind. Healthcare has shifted. The traditional way of approaching healthcare is no longer the same. And I think that as healthcare leaders, we need to adopt this growth mindset, and not just be stringent in our way of thinking. Global practices cannot meet local needs. Yes, they can you can learn one or two things from it, but at the end of the day, the market and the context are much more important than the global practices. In 2025, at HSB Global podcast series, we've hosted 25 sessions up to date. I think you should give us a round of applause, because it's honestly not been very easy. And we do this all because we are interested in serving the patient at the last mile. We believe that just creating an opportunity to cross learn and to share, leadership tips, market tips, system tips across different markets, we can help patients in the last mile, patients who need healthcare, get the healthcare just by equipping the leaders and the business mind, and also people who are interested in investing, or exposing the opportunities to invest in different markets. And this is why we do this. This is why we are still here, and we will still be serving you in 2026. So We hosted 25 sessions across 4 countries. We have a mission to, we have a mission in HSB Global to analyze the 297 global market. Yeah, 297 global markets, and I think for me as a market access professional, I've been able to, interact with markets across LATAM, EU, the US, APAC, and Africa and Middle East and North region. As part of my MBA, I did a course in emerging market, and I think it was one of my best courses in my MBA class because it made me realize, yeah, I've been working as a market access professional. In fact, I've worked in companies where I had to oversee 150 markets, and that was what fascinated me to take that course in emerging market. And I think one unique thing that I really appreciated in that course is how very unique and how different markets are, and how it's very important to understand the context, before you can innovate or do anything in that market. So taking a best practice in somewhere like EU to somewhere like, Brazil, or somewhere like, it really sometimes may not work, right? And that is why you have to be exposed to see how you contextualize the ideas or the innovation you're trying to bring into your market. Yes. So we've grown. I think I'm very excited for that. We've grown and we are still growing. What started as just exposing opportunities in a particular market has grown global, and we are taking this much more serious than we have done in the past months and the past year. 2026 is going to be a year of back-to-back consistent giving you of valuable content, engaging with leaders. We are also going to be welcoming some brands to work with us in exposing their business, their operations, their product, their services. And so keep your fingers crossed, because my team and I have really gone to the drawing board to really see how we can make this better for you as a business professional. So I think this is a good time to ask you to please subscribe to this channel and all of our social media channels. We are on Instagram, we're on Twitter, we are on Facebook, we are on LinkedIn, we are on TikTok, and we're on YouTube and Spotify. So please do me a favor, go like this channel now. Thank you. That keeps us motivated to see that we are doing something right. Thank you. So I'm just going to do a very quick review of some of the series we've had this year. And I'll start off with the local leadership series. Like I said, I feel in HSB, we have a three-pronged theory that by fixing leadership, by fixing the understanding of the market and how the market operates, and also by fixing the system, like the systemic barriers, like policies and all of those things, healthcare can be better for patients globally. And that is why our podcast series has taken this three-pronged approach. In the local leadership series this year, we are very opportune to have a very special guest in person of Dr. Ninaya Kalu, who is a head or leads in the Nigerian healthcare insurance scheme. I think learning from her was one of my highlights, and I think you should listen to some of my highlights from her.
I'm sure you're not a local leader, you are a global leader in terms of like healthcare. You are all over the world. But I'm just curious to know what local leadership has meant for you, both in the high places in your career and how you build and how you show up for patients in the world.
Yeah, so thank you so much for that question. And local leadership for me, it brings to mind two things. I mean, the context and also the systems. So you have to really understand the situation around you. What's the context? What are people going through? What are the pain points? Are there barriers? Are there enablers? Are there allies you can rely on? So once you understand that, and for you to do that, it takes sometimes getting off your high horse, dropping whatever thoughts and ideas, whatever you've thought about before, and just sitting with the people and understanding what they're going through. So, because you can't design an intervention without really understanding the people. So, and no matter what degrees, I mean, best practices are wonderful, but you need to integrate that with what's on ground as well for sustainability. And then for the systems, you get to realize over time that you can't do everything yourself. There's no way you can't do everything yourself. So therefore, you must have systems, you must have people, you must have teams. Put all those together so that even in your absence, things keep running. So that's really, really important as well.
Thank you.
It's not just about the title. You don't need to wait for your turn until they hand you a title and say, yes, now you're a leader. And then you begin to wonder, where do I start? No. And you start from where you are. I mean, you can lead horizontally, you can lead vertically, both up and down. It starts by, and you can transfer leadership skills from, different places. I've been a children's Sunday school teacher for about 20 years as well. And for you to teach children, you need a lot of patience.
Really.
And I wasn't a very patient person initially, but I had to learn and transfer that, I use that as well at work. So that's one of the things. And then I mentioned learning, unlearning, and relearning. So having that learning mindset also helps you as well. Don't always think you're right and you know it all. No, you can learn from just about anybody. Another thing is working with people, getting along with. If you're looking at results, you don't always have to like everybody, but you need to learn to work with people. That's really important.
So as you can see, this is the best channel to learn from best leaders across healthcare. Also, this year on the local leadership series, we also have the opportunity to have Dr. Idong Esiet Gibson, who I personally think Dr. Idong is a phenomenal woman. I personally think she's a phenomenal woman. She's someone who, I'm inspired by daily. Um, I think her journey, 21-year experience, if not more than that. I think, why am I saying 21? 31-year experience in healthcare, and having her to sit, to share some of her biggest lessons and experience in healthcare was not just heartwarming, but I think it's a valuable opportunity to learn from somebody who has done the work and has walked the talk. And I learned some of her golden lessons on leadership and when culture meets science, right? She talked a lot about how, the cultural context differ, and, just learning from her journey across different global health terrains, risking her life in the peak of COVID and Ebola virus. I think that was very phenomenal, because leadership all is all about setting example. I can imagine being sent to the field to, go and go and check patients who have Ebola. I think she did a phenomenal job there. And I really want you to listen to some of her top lessons in 2025 and through her career. So watch it.
First of all, leadership to me is the ability to take action, the ability to motivate others to accomplish a mission. And so when you think about the local, so it's really, when you say local, I think of it as the local context. That as a leader, you always have to think about the local context in which you're trying to implement whatever you're trying to do, whether you're introducing a new digital health product, or you're introducing an HIV prevention program, like whatever it is that you're doing in that sphere, you always have to think about the local context of what you're doing. You've got to value your people, because at the end of the day, you're depending on them to get things done. And so you've got to take good care of your people. In the military, we always say that, you want to be able to take the hill, but you've got to have people that are willing to take the hill with you. Because if people are not willing to follow you, you're going to be on the hill by yourself. So you've got to make sure that you're treating people where they're not going to leave you hanging.
Thank you.
I've shared quite a few today, but I think the one that comes up as you say that is the one about, what do I have in my hand? So I always think, what do I have in my hand? What do I have in this moment? What is the one thing that I can do? Because in those moments when you feel overwhelmed and there's just so much going on, or it looks like there's no way through, and you get the report that says, nope, you can't come to medical school, like we're done. Like, what are you going to do? I always stop and say, okay, what do I have in my hand? What can I do? What is in my power? What's in my sphere?
So yeah, as you can see, Dr. Idong, thank you so much. I want to say a big shout out to you. I wish you the best in 2026, and we hope to have you more on the podcast. Then we're going to move to the Market and Startup Spotlight series. On the HSB podcast this year, we introduced the Market and Startup Spotlight series because we believe that having a fundamental understanding of the challenges, opportunities, the gaps within certain markets can help not just investors, but also help you contextualize how you can, adopt or expand your solution base to other markets. And we had the privilege to, have some leaders across different countries to come share with us the uniqueness of their market. Starting off with Jesse Kisia. What would I say about Jesse? I feel like Jesse inspired me. Jesse is one person who I think everybody should keep an eye on, because I don't know how, I told him I don't know how someone will leave a computer science degree to come and solve for healthcare. Like he is a phenomenal person. I think that what Jesse is doing in Namibia is just is beyond word. It's just unique. It's inspiring. I personally am inspired by his journey and how his ambition. Like just listen to him. Just listen to him.
The problems are quite similar. The problems are the same. Malaria
Okay.
taking lives, HIV and AIDS taking lives, TB taking lives, diabetes taking lives, and the problem is lack of medication, lack of awareness, lack of education, lack of understanding. What do I eat if I have diabetes? Or what do I do if I get infected with malaria? My mom just got a baby. What kind of vaccination should she get this baby? So the baby can make it into a toddler and then become an adult one day, you know? It's very similar
Yeah.
problems all across Africa. I think the way to solve it, the way to like close the gap is if there were more entrepreneurs solving or fighting this problem. I believe that we at Patient Care will probably only solve 10-15% of Africa's problem. We need more. The other problem is policies are great, beautiful, but the problem is that they're not digitalized. So you can send your prescription via WhatsApp and the pharmacy will deliver this because on WhatsApp you can drop your PIN or your location PIN. And you can provide your name and the pharmacy can go through the system to see if your insurance number or your name makes sense if it's on the system. And if it's on the system, wonderful, we'll deliver the medication. However, they are not digitalized. So what I mean by this is, again, to start a pharmacy costs you a whole lot of money. And Africa is a continent of young people. We don't have that kind of money to just start a business, you know. So it's difficult for them to just become entrepreneurs or businesswomen or men. So with that, Patient Care is now digitalizing them, and we've created an e-commerce model for them. So the problem for them is startup capital and a platform where they can sell their prescriptions and medication online.
Thank you, JC. Thank you so much. We are so honored to have had you in the podcast this year. Um, I am so honored to have you on the podcast this year, and we hope to see you succeed in what you're doing and always support you in how any way we can. We'll always support you because what you're doing in Namibia is just phenomenal. You're saving lives. You're helping patients get access to care. You're doing a lot, and we're so grateful to have someone like you. Another leader we had on the Market and Startup Spotlight series is Anodi. Anodi is also a phenomenal healthcare leader. Is the founder of, is also the founder of Ubuntu Afia, which is like a common grade of healthcare startups. I don't know how he does it because what Anodi is doing is is building like 5 different startups in one. I think it's very ambitious, and I really want to commend these men because ah, they're going beyond and above. Just listen to him and see how what you can learn from the market in Namibia and all.
But one of the things that I wish that I would have known earlier is just about the power of the team. Just me assembling the brilliant talents
Yes.
was very important. Was a very important step, and I think I was able to do this because I was carrying the experience of way back building at the Afiari, which now continues to be one of the fast growing startups again in the Tanzania ecosystem, delivering maternal health solution to the primary health care and to the last mile. But the power of the team and how to attract brilliant talents, how to motivate them, and how to make them just build something that will really create the impact.
Thank you.
I think that quote would be to one of my mentors and the person that always been inspiring me alongside throughout my career journey, Dr. Antuli, who said, "Be my hero in building, in saving the mothers and newborns." So, just being a hero and saving the lives of mothers and the newborns. So, always that resonates with me and it keeps me grounded into the field. And everything that I design, I make sure that I remember how does this save mothers? How does this save newborns?
That is it's very actually something that can put you on your feet and give you chills. Be my hero in saving the lives of mothers and newborns all over the world. That is a big, ambitious, quote that can keep you on the ground and make you wake up every day.
So what I took out from the market and startup spotlight series is that, as a founder, it's very important to have the best team, because I think two of them mentioned having the best teams would really make things work. I think I learned that, you have to have the best teams, you have to work with your team. You also have to have a big cause and a big vision you're servicing, because I always ask my guests what is their why. And I think both of them had really fantastic whys. Their whys were just beyond inspiring. I think it's something that is really commendable. So thank you to our guests who joined on the Market and Spotlight series. And lastly, this year we introduced the System series. System series really to just talk about the big things that affect healthcare, like financing, the political system, regulation, um, enforcement of regulation, system monitoring and evaluation. I think these things are very important to discuss, because it helps you to see that healthcare is not something that works in silos. There are things that really are systemic barrier to scaling and operationalizing healthcare. And on the system series, we had Dr. Abayomi Sule. I think for me, it was really truly an honor to have Dr. Abayomi Sule on the podcast this year, because he's someone I've watched. I think I knew Dr. Abayomi right from my undergrad. I always saw him as a thought leader in the health financing space. He's still a thought leader in health financing space. I think you should follow him, look him up, and just read some of his articles, his blog posts, and all. And he's really doing a fantastic job in trying hands. I mean, I don't think anything. What I learned from Dr. Bayomi is that nothing really beats experience. Like that experience, that on the ground, putting your hand in the dirt and trying out things. He has done a lot in the health financing space, and I think he has a better sense of what works within LMIC in general. And he's also building a startup in that space. So Dr. Abayomi has this to say.
Yeah, so like I said, a lot of people focus on just the purchasing aspect and they think healthcare financing about how providers are paid, but it's much more than that. You have to think about how the revenues are raised. Is it going to be tax based? Is it going to be universal? Is it going to be mandatory? Is it going to be voluntary? Is it going to be contributory? How do you pull the money, the funds that you have raised? Is it going to be in one big universal pot or pool, or is it going to be multiple fragmented pools? And finally, what sort of purchasing instruments do you deploy to be able to achieve your population health objectives? It's very important to have those objectives because healthcare financing is not an end in itself; it's a means to an end. And at the end of the day, you should have your targets. Do you want to reduce maternal mortality? Do you want to reduce or you want to increase life expectancy? What exactly are your population health objectives? For me, it's very critical that people understand that healthcare financing is not an end in itself, it's a means to an end. And so you have to be clear about the end. You have to be clear also about how you're going to raise revenues. You also have to consider the society where you live in. So, I mean, I always say it somewhat that everything we've done and everything we are doing is a social experiment, and we should take feedback from it. If it's not working, we should pivot. Even from a policy perspective, pivots are not just health tech or technology-driven initiatives. Even within the public sector policy space, if you have been doing something for 20 years and it's not working, you have to ask yourself, what else can you do? And you want to change, you want to look at what else you can do as well. And so I think it's important to look at it from that way. So within the public sector, we've tried. People have felt that, if all they needed to do was to pass a law saying health insurance was mandatory, everybody would comply. But it's not so. Health insurance is cultural, it's social-cultural. There are social-cultural drivers, around the decisions that people make to procuring insurance and even health insurance. So unless you design initiatives that are the initiatives that kind of key into the natural health seeking behavior and health buying behavior, I'll say you're not likely to get any traction. Another big misunderstanding is thinking that if you pass a law, everyone is going to comply. The other big misunderstanding I've talked about is people thinking that healthcare financing is just about provider payments. It's much more than that. And like I also mentioned, people also think of healthcare financing in isolation. They don't look at it as a tool, which it is. It's not an end in itself. It's a means to an end. Your end also should always be making sure that people are financially protected, that everybody can access the healthcare they need, regardless of their financial circumstances. You talked about someone who will spend 80% of their income. The vast majority of people will not even be able to access healthcare if there were no universal health or universal health financing initiatives as well. For the private sector as well, there's a misunderstanding that social healthcare financing initiatives are inferior to out-of-pocket payments. And so they continue to double down on making sure they get cash paying clients in. But like I mentioned, it's a case of, do you want to serve one or two people who you're not sure whether they're going to come, who will pay you a lot of money, some sort of surge pricing initiative, or you want to be able to serve, everyone in your community, where funding is not a barrier. I would argue that it's not sustainable to be able to know that you are in a population of 100,000 people who can pay for your services, than to be in a population of 100,000 people and you don't know the 100 people who can afford your services. So one, customer acquisition is easier when you know everybody can pay. You can also manage their health better as well, and make sure that they get the sort of outcomes they deserve and you desire as well. Yeah. Perhaps principle. I mean, a couple of principles that I live by. And maybe one that comes to mind is reciprocity. Yeah, the world will always give you what you give to it. So if you throw out a lot of goodness, you'll always get a lot of goodness in return as well. Yeah, maybe I codify it by, you would always reap what you sow. Where you reap it, I don't know, but you will always reap it. It doesn't have to be where you are right now. I mean, it doesn't have to be in this time and space. It could be some other time and space as well. So yeah, I live by.
I love that. The world would always give you what you give to it. I think that's very important to keep it. Especially in this health financing topic we've talked about. You're giving your best to it. And thank you so much, Dr. Bayomi. This has been very insightful.
Thank you, Dr. Abayomi. So if one thing I also took away from Dr. Abayomi is also the fact that, if you want to do something in scale, you can't just work alone as a private sector. You have to find a way to plug it into the public healthcare system, because that's the way to scale. That's the best way to scale. And I think I thought about that a little bit, because in developed countries like the US, it's funny how people think that healthcare startups are working really fine. Yeah, they are. There are a lot of. There've been a couple of IPOs in the healthcare space in the US, but I don't think it's anything different from what we have in other markets. I think it's all about startups or businesses that have found a way to successfully plug in. I think one of the reasons why this kind of startups in the US are able to meet IPO is because somehow the payment system for healthcare in the US is kind of centralized. You have the Medicare and the Medicaid. And I don't think a lot of countries have gotten to that stage where they have been able to, find a centralized system for healthcare financing and healthcare payment. I think this is very crucial for the success of building any healthcare business across the globe. So yeah, thank you, Dr. Abayomi, for just being here on the podcast and sharing some of your valuable lessons. I don't take it for granted, and I want to say a big thank you to you. Also, I had the privilege to share some knowledge on AI for healthcare. I think you should listen to this. In that regards, we're going to be hosting a AI summit in March. I'm going to say this again because this is going to be the best session I promise you value. And we're already having a lineup of speakers and facilitators for that session. So keep your fingers crossed and make sure that you watch our YouTube channel from time to time, because the information is going to be going on there before we start. So thank you so much for joining us in the podcast this year. It's been nothing short of an amazing year. And 2026 is definitely going to be a better year for us at HSB Global Podcast. Now, in summary, we're going to talk about the 5 big lessons for us as the podcast house working in the business of health. We've learned that innovation without system fails. I don't think I should overflow that. That is very important, because it's very easy to think about a healthcare problem and how. In fact, I attended the Global Health Digital Forum summit that happened in Kenya, and I had the opportunity to sit in some of the most interesting rooms and learn about the different innovations in Africa. I think most of the people who attended were really working in Africa, and I was just really fascinated about how innovation is moving. But I don't think There's one thing innovating, and there's one thing actually getting market access for your innovation. And that is what we do at the HSB Global, supporting healthcare leaders with strategic insight, knowledge, and positioning for their healthcare innovation. It's one thing to do, so it's one thing to have an innovative idea, it's one thing to actually have paying customers, it's one thing to make people know about your ideas, one thing also to scale up that idea to a level that you can make profit from it. And so this is something that I think all healthcare leaders should really begin to think about. One thing is innovation, another thing is building systems around your innovation. Yeah. Another key lesson we learned in 2025, I think, is financing is not a strategy. Financing is a strategy, not just an afterthought. I think this is something that we've seen in the team of the year, the big shift here. Financing is strategy, right? You need to think about, how do I finance this? Even your paying system, your pricing options for your healthcare innovation. How do I price this? What's the best price point for different kind of patients, different kind of high income, low income, middle class patients. So I think it's very important that you see that financing is a strategy and not just an afterthought that you need to think after innovating your idea. Also, I don't think we need to overemphasize the fact that local context beats global assumptions. I think that's one thing that a lot of people who are looking to innovate in different markets, are not aware of. They just go in, this sounds like a brilliant idea, but at the end of the day, it's really about the local context, not just your global assumptions. So before you launch your idea, you need to test those assumptions and make sure that the hypotheses are correct before you launch your innovation. Another thing we learned is that leadership is discipline, not just passion. I think almost of all other speakers talked about their quotes, their favorite quotes of the year. I think you're just gonna see a flash of that. And one of the things we learned is that leadership is discipline and not just passion. So to succeed in your healthcare business, you need to build discipline around your business and not just passion. Lastly, I think we're wrapping up the review of the year. Healthcare is serious business. Healthcare is truly serious business, and patient life, there is no price to human life, and I think it's very important to honor that, and make sure that we are supporting the leaders the best way we can with the right tools, the right knowledge, the right support, and that is what we do at HSB Global. We are here to support you as a leader in healthcare to make sure that you have the right support. You don't need to contract, just need to contract us. We are not expensive. We are really flexible, and we are contractors. Basically, anything you want to do within the healthcare space, we are here to make it happen. I don't know, anything, and I mean it. Anything you want to do in your business of health, we're here to make it happen. So please, you know where to reach us. Thank you. And at this point, I would like to send a very big thank you to all of our guests. This has been truly an amazing year. I also want to say a big thank you to all of our listeners. Thank you for listening and tuning into the podcast. We are so grateful to those who have subscribed to our channel, for those who are commenting, those who are consistently supporting. We are so grateful for you all. And I want to use this opportunity to wish you the best of 2026. We hope that this will be a better year for us in global health and just patient lives globally. Thank you so much, and stay tuned because we are not going anywhere. We only just got started. Thank you once again. My name is Ezine Aso, and I'm your favorite host of the HSB podcast series. And next year, you'll see some new faces. And I want to say a big thank you to my team who have supported this journey. Thank you to Mr. Daniel O, who is the visionary of HSB Global and who has provided me with a lot of confidence to come out to speak about this very, very important topic. Thank you so much, and have a great rest of your year, and hope to see you in 2026. Bye.
Thank you for your support this year. 2026 promises to be very exciting.